So let's talk about the virus. What are we seeing in the emergency rooms? We're seeing virus symptoms, most commonly that of fever. We're seeing people with the dry cough that we talk about on the news and TV all the time. These are most common things: fever, cough, and malaise. The flu as well gives you these symptoms. So it's a bit of a challenge sometimes to determine, do you have the flu or do you have the virus? But in this pandemic setting, if you have these symptoms, you can rest assured that you may very well have coronavirus. But that doesn't change the treatment pattern or what we would do for you. If you were to come into the emergency room, the first thing we do is try to identify, are you at risk for exposure to a coronavirus? There are certain individuals who are at a higher risk. People who are over the age of 60, they do present with symptoms that progress fairly quickly. And people with diabetes, hypertension, heart disease, lung disease, those who are immunocompromised, so people who are taking prednisone, for example, or taking medications for rheumatoid arthritis, these individuals can rapidly progress to a more serious condition. So if you have these symptoms and you have these risk factors, you do need to present to the emergency room for an assessment. If you don't have these risk factors and you have some sniffle, for example, you start with a mild sore throat or a mild fever, you don't always have to come to the emergency room. You need to quarantine yourself. You need to make sure that you're away from other people who can potentially get this virus. This is very important because if you do come to the emergency room and you don't have the symptoms, we will assess you. And if we find that you are stable, your vitals are stable, we will send you home with the instruction to quarantine yourself and to return to the emergency room if your symptoms worsen. And that's important as well. Healthy people can get worsening of symptoms. We've had cases of people in their 30s and 40s succumbing to this virus, having to be put on ventilators, having to be intubated. We've had cases of individuals with risk factors more frequently having these situations occur. I don't want to trivialize it, but I don't want you to be less vigilant about it. I think it's smart to know the facts and protect yourselves. If you are someone who was over 60 years of age, over 70 years of age, then the Minister of Health has recently recommended not to leave your home. It's important. If you follow these guidelines, you're more likely to protect yourself and, more importantly, slow down the spread of this disease.